More than 1,000 healthcare workers in East Texas have received their first doses, and that's our focus today because a COVID-19 vaccine is no longer just an idea, it's here. We'll hear in a bit from the hospital administrators who saw months of planning pay off, but first we're going to focus on the frontline healthcare workers who received the vaccine. I was there as the first among them rolled up their sleeves at UT Health Science Center Tuesday afternoon. Here's what they had to say about the experience and its meaning.
So tell me, how did you feel being among the first?
Excited. Been looking forward to this for a couple months now, so it's a great privilege and opportunity for us.
How are you feeling?
I'm feeling great, thank you.
What was it like to be the first person in East Texas to receive the vaccine?
I felt very grateful to be the first person to receive the vaccine.
So tell me, how were you feeling being among this first cohort to get the vaccine?
Happy, excited, elated, relieved, hopeful, for tomorrow, because we need hope. This entire country needs hope right now. After all the devastating loss and all of our patients and what it's done to our economy, it's time for us to have some hope.
How would you compare the physical sensation of getting it?
I could barely feel a shot, literally. Easier than the flu shot.
You know what? I mean, I've been a nurse for a really long time, and I've had a lot of inoculations, but this did not hurt at all. It didn't. I mean, it's not very much medicine. It didn't hurt. My arm's not sore. It was way better than a flu shot.
It's like receiving any other jab or a vaccine. There's really nothing in it. It's not painful. It does not burn. It does not sting. It's over in a second.
And why did you want to sign up to be in this first handful?
Oh, just because I'm around COVID patients all the time, and the sooner the better.
Why did you want to volunteer to be in this first group?
I feel that as a frontline healthcare worker, it is our duty to step up and take the vaccine to demonstrate to the general public that it is safe to do so, not only to protect yourself, but also to protect our community.
Interestingly enough, because I've said all along, and Dr. Yates and I both have said all along, as soon as there's a vaccine, we are first in line. And I'm so excited to see so many other faces, so many people coming forward saying, I want to be first, I want to come up there, I want to be in that first round. And, we are a research-driven campus. This is an evidence-based practice research-driven campus, and all these physicians and nurses are coming together, and pharmacists and physical therapists saying, we want this to stop. And the only way to make that stop is this vaccine.
Any hesitation about getting this shot, given that it's still brand new?
No, none at all. Tens of thousands of volunteers has taken it before me.
Looking back at the summer when we first started talking about the idea of the vaccine, did you think it would be here today?
No, absolutely not. The technology is amazing. The mRNA vaccine, which is a new technology for vaccine. They can make a lot of quantities, very specific, high quality. So it's a very exciting medical technology.
What would you tell that third of the country that says they don't want to get the vaccine, or they're afraid to, or hesitant? What would you say to help convince them that it's worthwhile?
There's so many different avenues to look at it, because if it's a personal fear or if it's because they're afraid that science wasn't ready for this, we've been ready for this. Technology has been ready for this. We've been working on, vaccines for years. This one just has impacted us on a completely different level. But I think more than anything is you want people to feel comfortable. Hey, I did this because I want my family and the next patients to be taken care of and protected. And that's what our responsibility is as public health leaders, is to, protect our patients. And this vaccine is part of that.
It's a very powerful tool to have, but we have to be careful and we have to be vigilant and keep on with our safety practices, the social distancing, the masking, the washing of hands. And once again, we have to encourage everybody to go and get the vaccine.
And what's it been like for you treating folks who are going through some of the worst of this disease?
It's a devastating disease for some people, and it's tough to see people suffer, and especially when they get in the hospital and they sometimes don't do well and they're in the ICU, and it's just a very difficult disease to see people suffer with.
I've seen severe debility, people that are extremely weak and debilitated from this horrible disease. It's not something I would recommend somebody get, so go and get the vaccine.
How worried have you been over these last 9-10 months?
I'm
That-
terrified because we've been on that line of seeing what it actually can do and how devastating the virus is. And I mean, you're terrified for your family. So I mean, luckily I don't have anyone that I could have given it to. But I mean, on a daily basis, your peers that you work with, it's always a risk. This is reducing that risk.
And Gary, as someone who's seen what COVID-19 can do over the past several months, does this kind of feel like the beginning of the end of dealing with this awful virus?
I really hope so, because what I've seen, I have never seen anything like this before in my 20-year career span. So I am hoping this is the light at the end of the tunnel. I'm confident this is the light at the end of the tunnel. But once again, we have to encourage everybody to get the vaccine.
Coming to work today, did you know you were going to be the first person to get the vaccine?
Yes, I did.
Did you sleep okay last night?
I slept just fine, thank you.